In this video, we're going to talk about cat neutering. Cat neutering is the procedure where we remove your cat's testicles. It's done under IV sedation. They're actually not intubated or under anesthesia for the surgery. Once they have been sedated and they have their IV catheter in place, we usually give them drugs to top up their sedations. We give them drugs as needed to keep them nice and comfortable. While they're having their procedure, they get flow by oxygen, and our vet nurses monitor their vital signs throughout. They will also have a local freezing agent inserted into their testicles so they don't have any pain. And the site will be clipped and cleaned and sterilely prepared. And from there, it's literally a 1 to 2 minute procedure. So the veterinarian will go in and make an incision over each testicle. The testicle then comes out, and there's two little tubes that go to the testicle. There's the vas deferens, where the sperm travels, and then there's also a blood vessel. These two get separated. The testicle is attached to one of these tubes, and we actually tie knots between the vas deferens and the blood vessels. So we tie knots on the tubes to stop bleeding. So we usually do 4 knots. When we're done, we make a cut. The testicle comes away, goes onto our surgical tray. The pedicle of knots gets checked, make sure it's not bleeding, goes back in. Do the exact same procedure on the other side, and then that's it. There's actually no suturing as well. We just squeeze the surgical site together and it heals just fine. Cats heal super well. So that's pretty much the entire procedure for cat neuter. The recovery time is 10 to 14 days. They need to wear their cone collar at all times, and we need to make sure that their incision stays dry and clean. They cannot lick at it. If they lick at it, they can get an infection or it could start bleeding. At the end of the 7 days, we'll ask you to bring them back for a recheck exam and just make sure that everything's healed well. That's it for the cat neuter.